Potassium is probably not the first thing that comes to mind when you think of the essential nutrients your body requires, but it should. The majority of the potassium in your body is found in your cells, where it aids in nerve and muscle communication, transports other nutrients, keeps your kidneys functioning properly, and prevents sodium levels from rising too high. If you eat a lot of fruits and vegetables, you should be able to get enough potassium, but unfortunately, many people don't eat enough whole, unprocessed foods, the type that are high in potassium. According to research, most people only get about half of the 4,700 milligrams of potassium they require per day. According to the National Institutes of Health, the most recent U.S. Dietary Guidelines list potassium as a nutrient of public health concern for this very reason, NIH. One reason a person might be low in potassium is that they aren't getting enough from their diet. However, this may simply set you up for insufficient intake rather than a true deficiency, also known as hypokalemia. According to the NIH, mild hypokalemia can cause constipation, muscle weakness, and fatigue. However, as the deficiency worsens, so do the symptoms. Potassium deficiency can be fatal. People who have a complete deficiency may experience dangerous cardiovascular problems very quickly. People who lose potassium rapidly through their urine or stool, such as those who abuse laxatives and diuretics, or who have a GI disorder, uncontrolled diabetes, or diarrhea, are much more likely to be deficient. Heavy sweating, such as during a hot outdoor endurance workout, can also quickly flush potassium from your system. A deficiency is a real possibility when potassium is lost due to medication or a medical condition, and it should be assessed and treated by a doctor. In an otherwise healthy person, an outright deficiency would be unusual. It can be difficult to tell if you're meeting your daily needs, but there are a few signs to look out for. Here are 6 signs that you're deficient in potassium, as well as how to supplement your diet. Don't forget to subscribe for more videos on ways to improve your health naturally. 1. Irregular heartbeat. According to the National Institutes of Health, a moderate to severe potassium deficiency can cause cardiac arrhythmias, or irregular heartbeats, especially if you already have a high risk of heart disease. Hypokalemia affects 7 to 17% of patients with cardiovascular disease, according to research. This is because of its effect on muscle contractions and, as a result, heart function. If your heart is pounding, fluttering, or skipping a beat, you should see a doctor right away. Irregular heartbeats are extremely dangerous and can result in cardiac arrest, which is fatal. 2. You are low in magnesium. All of the nutrients you consume on a daily basis work together to help your body function optimally, so if you don't get enough of one essential nutrient, you may become deficient or insufficient in another. Magnesium, a mineral involved in hundreds of chemical reactions in your body, transports potassium across your cells actively. When your magnesium levels begin to fall, which can be found in spinach, nuts, soy milk, black beans, avocado, and peanut butter, your potassium levels may suffer as well. According to the NIH, more than half of people with severe potassium deficiency may also be magnesium deficient. 3. High blood pressure. In the body, potassium and sodium are in balance. There is some evidence that having too much sodium and not enough potassium can contribute to high blood pressure, which can lead to stroke. Consider potassium to be salt's main ally. When you consume too much sodium, your blood vessels become stressed. According to the American Heart Association, because potassium works to flush the stuff out of your body, it can mitigate some of the heart-damaging effects of excess salt. Furthermore, potassium relaxes your blood vessel walls, which can help lower your blood pressure. 4. Kidney stones. Kidney stones are mineral-rich hard masses that form inside your kidneys. Passing them through your urine can be excruciatingly painful, but if you catch one early on, they usually don't cause too much damage. According to the National Institutes of Health, in a study of more than 90,000 women aged 34 to 59 with no history of kidney stones, researchers discovered they had a 35% lower risk of kidney stones after a 12-year follow-up if they consumed more than 4,099 milligrams of potassium daily compared to women who consumed less than 2,407 milligrams. Calcium stones are the most common type, and because potassium helps your kidneys flush excess calcium through your urine, a lack of it can cause these masses to form. 5. You feel lethargic. There are numerous factors that can sap your energy, including dehydration, medications, and even certain medical conditions. However, if you've been getting enough sleep and still feel tired and sluggish during the day, you should reconsider your diet to see if you're getting enough potassium. Because your cells rely so heavily on potassium to perform their daily functions, eating more potassium-rich fruits and vegetables may make you feel more vital. 6. Muscle cramping. If you frequently experience painful muscle spasms in your legs, a lack of potassium may be to blame, because you lose electrolytes, including potassium, during a strenuous workout. A lack of potassium can cause muscular complications in athletes, such as problems contracting and decreased blood flow, which can lead to dangerous rhabdomyolysis, a serious condition in which your muscle tissue breaks down quickly, often resulting in kidney damage. A lack of potassium can cause muscle weakness, fatigue, and cramping in athletes. So how can you ensure that you're getting enough potassium? The best way to meet the daily potassium requirement of 4,700 milligrams is to eat plenty of fruits and vegetables. According to the Centers for Disease Control and Prevention, only 1 out of every 10 adults consumes the recommended amount of fruits and vegetables, at least 1.5 to 2 cups daily, at least 2 to 3 cups daily. Although bananas may come to mind, there are many other foods that are high in potassium. Whole foods that contain it include leafy greens, tomatoes, cucumbers, zucchini, eggplant, avocado, pumpkins, potatoes, carrots, raisins, beans, dairy products such as milk and yogurt, meat, poultry, fish, and nuts. A doctor may prescribe supplements if a patient has a medical condition or is taking certain medications. Remember that supplementing with potassium on your own can be dangerous, causing problems with heart rhythm or even cardiac arrest, so always consult your doctor if you have questions about getting more in pill form. So there you have it. Be sure to subscribe for more videos like this.